Welcome to Rockingham County 411. You're in a good place. I'm Mabel Scott, your Public Information Officer. Joining me today for a COVID-19 update is our Interim Public Health Director, Susan Young. Thank you, Susan. We know you have a very busy schedule.
Thank you, Mabel.
What we'd like to know is, what is it like here in Rockingham County now? We've heard about the increases in Europe, across the country. There are increases also here in Rockingham County, right?
Absolutely. We are not immune to the increases that are occurring all across the United States. Some places are, of course, higher than others. North Carolina is holding its own, but now we have seen an increase in cases in Rockingham County also. We actually had 29 cases added to our count today, so we are at 2,011 cases for the day today.
And the 29 cases are the patients who passed?
Yes. We have, unfortunately, we have 29 deaths that have occurred here in Rockingham County since the COVID-19 virus first came about.
And we certainly send our love and our prayers to the families of those who have been affected. So where exactly has all of this been happening? Is it in specific cities or towns, or?
Well, it's all over the county, and no place is immune, but of course Reidsville is our highest count of numbers. Currently, it is the most populated area in our county, so that's kind of to be expected. Ethan, Madison, Mayodan are like second and third, but they also had the long-term care facility numbers to add to their numbers. But we're seeing a rise in Summerfield. It's everywhere. There's nowhere that's immune.
What about those long care areas?
Well, they have kind of subsided. We are having sporadic cases at some rest homes and some other facilities, but no clusters or outbreaks have been reported this week.
Thank God. What about schools?
Schools are virtual today, and they have been doing some virtual learning on the Wednesdays. We are still on that, what we call the AABB schedule, where kids are still coming to class, if they so choose, 2 days a week. And we are still seeing an increase in that age group. The school age children are increasing in cases. It's not actually a lot of clusters within the school. The kids are getting the virus outside of school, and they're coming to school. So it's not actually being spread child to child in school. And a lot of the cases that are in the school system are from adults, cafeteria workers, teachers, teachers' assistants, maintenance individuals. It's a lot of adults that are coming into the school system.
Okay. And are you seeing many cases coming from social gatherings, or?
Yes, that is the greatest increase. Now family gatherings are the top spreader of the COVID virus. There is new guidance that came out just this week from Zach Moore at Public Health, and the guidance is called Interim Guidance for Private Social Gatherings, and I'll go over this just a little bit. But there is a website link that you can find this information. But it's of course saying if you're going to host an event, it's giving you some guidelines on how to do that more safely. And I think the number one thing to do that is to be sure that no one attends your party or your gathering that is ill or has been exposed or are supposed to be in isolation or quarantined. That is the most important thing. We don't want anybody there who could potentially spread the virus to be at your gathering, and then that's when it explodes and almost everyone there. The guidance is still 25 people indoors, 50 outdoors. That has not changed, but I don't know, Mabel, if you're like me in my house, definitely cannot hold 25 people socially distanced safely. So you've got to think about how you can social distance people within your house. And remember, if you're eating or drinking beverages, you're going to have your mask off. If you ask people to wear a mask in your house, they're going to take it off to eat and drink. You need to be thinking about those things that you're doing while you're inside the enclosed space.
So we will make sure that we attach a link so that you can get all of these details that Susan just talked about. As far as the 3 deaths that you just mentioned that recently occurred, can you give us any additional information about demographics or what exactly happened?
They are in their 80s to 90s. And we are still seeing a lot of our deaths come out of our long-term care facility outbreaks, and those people that are in that age group are still the most vulnerable to pass away.
You gave us some suggestions a few minutes ago as far as the upcoming holidays, and they are just back to back to back.
Yes.
Do you have anything else that you want to share with us so that we can be more cautious?
Well, it's really encouraging you to stay with your tight-knit family unit. Do not go out with extended family and be around extended family. The family unit is the people that live under your roof in your household, or make the gathering as small as you can. And please remember, those 65 and older are considered vulnerable. So just be careful if you invite them, to try to do social distancing, wear your mask, do the 3 W's the best you can. There is a lot of good guidance about that, but that is really the focus right now, because before we had certain areas that we could really work on, like college-age students or different students, but right now it's social gatherings, family gatherings, parties, and things like that. So we're really trying to focus more on that.
And as usual, I always ask about our homework. What do you want us to do?
Well, I want everybody to wash your hands, social distance, and wear your mask. I think mask wearing is one of the preventative things that we can do that's so important. But I did want to speak a little bit about, the health directors had a call today about what we can do as far as enforcement. And I know nobody really wants to talk about this, and well, it is kind of a hot topic in some realms, but it's hard for people to understand, the importance of it. So they have given health directors a few more tools in their toolbox to help, people to understand. They have given us letters that we can send out that kind of reiterates personally, what, you need to do this, and we really are watching you to be able to do this. And you may get a certified letter. You may have a police officer deliver that letter to you if you have been found that you are not a person that is socially isolating and you are sick. So there are other tools in the toolbox. It is now, you could, if you're a restaurant owner and you continually do not do what you need to do and there are issues, there may be a letter that's going to be coming from the state, and you will have to address that letter with a return rebuttal to them. So it is going to be a little harder if we just see blatant things happening. We don't really want to use, we have what we call an abatement rule, but health directors really don't want to use that rule if they don't have to. This is for large gatherings. They used it at the racetracks in the beginning to kind of keep people from gathering. And it talks about an imminent hazard. So if you know there's an imminent hazard and you're getting people together and you're like a reckless exposure to spread the COVID virus, that is very serious, and they're going to take that very serious.
And we do appreciate the freedoms that we have here in America. That's what being an American is all about.
Right.
But at the same time, being patriotic, I think, is wearing a mask.
Right, and I think it's being respectful to yourself and to others and your loved ones. And it's also personal responsibility. It's each individual's personal responsibility to do this for others and themselves.
It was difficult. I remember the time, and I'm a little older than you, but I can remember when we were driving without seat belts.
Yes.
And when seat belts came along, we didn't want to, well, I kept saying, it's going to wrinkle up my jacket, it'll wrinkle up my dress. But you realize, and especially when you looked at those videos of those dummies.
The data
yes,
tells the story.
It can save lives.
Absolutely.
So just as we get in our cars and put on those seat belts without even thinking now, let's, whenever we are around people, put on our mask. Let's put on our mask and listen to the data, listen to what the scientists and our doctors and nurses are saying, and understand it's all to keep us safe and to keep us alive. This is the real deal.
Yes.
It is. Thank you so much, Susan Young, our interim public health director here at Rockingham County Government. You're in a good place here in Rockingham County.